In-home colon cancer tests may be more convenient, cheaper, and less invasive than colonoscopies, but a new study finds more than 10% of them can't be processed, mostly due to patient error. One author says understanding and mitigating barriers to successful colorectal cancer screening is critical for improving CRC outcomes. Researchers reviewed in-home immunochemical fecal tests submitted by nearly 57,000 people between 2010 and 2019. They found about 1 in 10 samples could not be processed in the lab. The majority of rejections were due to inadequate specimen collection, followed by incomplete labeling, the age of the specimen, and broken or leaking containers. Patients who got their kits in the mail rather than from a doctor were at greater risk of failure, according to the results. The authors say these findings could impact other at-home tests, such as fecal DNA tests for colon cancer and future home testing for the human papillomavirus. They say increased patient education and timely follow-up when there are problems will help reduce failure rates and improve patient care through early colon cancer interventions.